I'm Robert Smith, MD. Mother's name was Wilma Porter Smith.
I was wondering if you could tell me a little bit more about your father's first wife. You said she died in childbirth.
Yeah, she was attended by a midwife. At that time, uh, I I can't really speak to the fact of whether they had a doctor in Terry. By the time I came along, my family doctor was a Dr. Hugh Banks from Crystal Springs, and he she was attended by a midwife, but was oversaw with Hugh Banks. Fortunately, my father was one of those few blacks again at that time who had could afford, did pay for doctors to come out, and Crystal Springs was 8 or 9 miles from Terry, and he oversaw, I know, the last half of our births, along with having a midwife.
Along with the midwife.
Along with a midwife. And that was common. You know, I did some of that when I first came back. I didn't want to do that, but that was just, yeah. When I first came back, I was what they call a GP. I later went back and became a diplomat of the American Board of Family Medicine, but when I first came back, I would get a house call, and guess what that house call may be?
Birthing a baby?
With a midwife. And that is, I don't recommend that for anybody.
Why?
It's a scene that you don't never know how it's going to go, and you could never give especially in a first baby. You can never know. You could never give. We did what they call clip the vagina a little bit, sometimes to help the lady have the baby. But you was afraid to give too much sedation for it's just not a good scene, even if you trained. And by that time, for some reason, I had wanted to go into OBGYN, and I started delivering babies when I was second year in medical school. I did what they call an externship. And at that time, Cook County was delivering more babies than any other hospital in the country. Black folk were leaving the cotton fields and coming to Chicago. And as soon as you could finish in one delivery room in Cook County, you go to another. In fact, last year, this is very interesting too. I had a lady who came from Terry who knew my family, and she said, brought me a picture of her grandson that I delivered. Now listen to what I'm telling you. This kid is 2 years ago was 66 or 67 years old. And she says, Dr. Smith, she says, I know you are probably 95 years old. She says, because you delivered my grandson, and showed me this birth certificate where I delivered this kid back in 1955. And she counted the years. But I was actually working as an extern, as a physician. And I started delivering babies back then, and every opportunity that I got, I used that opportunity to work the emergency rooms or work the delivery suite, and I was needed. But we have gotten away from midwifery, but this is what brought me back here. And after later on, I was not really confronted at that time with midwifery, but after the next year, they shot and killed Mega. And I, along with 3 other physicians, that book that she was talking about, The Good Doctors, you see me leading the picket line, which brought attention nationally and linking the civil rights movement to what? Healthcare and the crisis, nationally and internationally, and brought when I got back home the next day, Highway Patrolman did the same thing again and took me to Jaquith. And of course, I was summarily fired, And that's when I made the decision to continue my work with civil rights and worked at Tulu and got introduced to live midwifery.